Hey everyone, welcome back to Heart Health with Michelle. Today we'll be talking about wound healing and heart health in a two-part series about prevention of it happening, and then if you have it, what can we do about it? And I am so excited to introduce my guest, Dr. Cazzell. If you could share a little bit about yourself, I'd love to introduce you properly.
Hi, Michelle. Thanks for having me, first and foremost. Yes, my name is Shawn Cazzell. I'm a practicing fellowship-trained podiatric diabetic foot salvage surgeon, completed a multi-year diabetic foot research sabbatical, unfortunately performed well over 5,000 amputations over the course of the last couple of decades. And I'm an active researcher, published author, clinical investigator, serve on medical advisory boards internationally, and have been kind of at the forefront as a global key opinion leader on the diabetic lower limb, advanced wound healing, and tissue repair for quite some time now. And I think that we've made it a mission amongst our group to try and promote education and awareness, heighten visibility in regards to diabetes and all of its comorbid conditions. And then lastly, help this at-risk population reduce the likelihood of becoming a statistic, right? I mean, I think that's the last thing that anybody wants, is to become part of a statistic. And I think we all have a unique opportunity in place to minimize the progression of this disease state moving forward. And I truly appreciate your time in heightening the visibility as it pertains to cardiovascular disease and a plethora of comorbid conditions that are afflicting the diabetes community. So with that, I thank you, and it's a pleasure to be with you today.
Yeah, thank you so much. So let's start off with bringing this into a case scenario. So what is a typical person that you see who is afflicted with a wound healing? What does that look like? What is it? What does that show? Tell us.
So our average patient, and I hate to say average, so I should say our prototypical patient that we see in an outpatient setting, so in our office or in our research group, is an individual that's had diabetes probably for 5+ years, suffers from diabetic peripheral neuropathy or abnormal sensation to their feet. There's an element of foot deformity there. It's progressed from callus formation because they have dry, dehydrated skin, secondary to peripheral arterial disease and the diabetic peripheral neuropathy. The callus progresses. They don't know it's there because they can't feel it. They can't see their feet. They can't reach their feet. It ends up leading to partial and full thickness tissue loss, which presents itself as what we call diabetic foot ulcers, or DFUs, which is how we kind of refer to it in the niche space that we're in. And they have an A1C value typically of somewhere between 8 and 12, which obviously is higher than where we would want it. And they suffer from multiple comorbid conditions. And so we're tasked with having to establish their element of arterial disease or adequacy of inline flow to the distal extremity, which obviously very well pertains to cardiovascular health, right? Being the pump that controls all. And then secondarily, we're tasked with establishing their baseline neuropathy assessment and whether or not they have their sensation intact enough to act as a protective threshold. And then secondarily, we must obviously minimize their risk with serial debridements, or basically cleaning of the wound bed, appropriate moisture control in regards to wound healing, offloading measures, and trying to keep them out of the hospital and getting them healed as appropriately as possible. And as you mentioned before, and as we were talking kind of off the record there, but prior to going live, you know, individuals with diabetes, as their A1C value or their 3-month marker is escalating, their ability to heal or their healability is going in the opposite direction. So these are divergent, and it makes for great difficulty in regards to their ability to heal wounds. And so there's been several studies over the years. I don't know if any of them are significantly robust or have tremendous power, but what we do know is that the higher the A1C value, the lower our ability to heal. And traditionally, we do talk about compliance, admittingly, and we have found that the higher rates of A1C, this is anecdotal, typically have lower rates of compliance. But that doesn't mean that an individual with a 12 or 13 in regards to their percent glycosylated hemoglobin is not a compliant individual, what we're asking of them is very difficult in the first place.
Right. So a couple of things, because I think for our listeners, we might have people in the medical field, but some people who might not be in the medical field. So I want to bring it down to a couple of points. One is you might be asking, why are we talking about wound healing in a heart health conversation? I think it's really important to talk about it in two realms. One is diabetes and heart health, right? So when someone has high glycosylated hemoglobin A1C, which essentially means that you have very high blood sugar levels as an average over 3-month time period, you're having a lot of blood sugar in the blood vessel, which causes stickier blood. But not only that, it causes underlying inflammation. It impairs blood flow. If you don't have good blood flow to your lower extremities, you will not be able to heal. Your skin is not going to heal, and it can cause also this wound to not get enough oxygen and nutrients and be able to thrive. So it's very correlated. I don't know if we can dive in a little bit more from your perspective of the conversation of how wound healing is associated with heart health.
Well, I think what you said was rather eloquent, and I think it was very on point, Michelle, because what happens is obviously with diabetes, we have a myriad of comorbid conditions. Obviously, we'll focus at the moment on cardiovascular disease, but we could be talking about chronic kidney disease, end-stage renal disease on hemodialysis. We could be talking exclusively about peripheral arterial disease. We could be talking about our visual health and diabetic retinopathy. We could be talking about stroke. I mean, but it's all connected. And I think that the nexus, obviously, here in what we're referring to or talking about today, happens to be the impact on elevated blood sugars and its effect on A, the cardiovascular system, and then B, how does that pertain in a way where our healability and our trajectory towards healing is remarkably reduced, correct? And so what we do know is that when we have alterations to our pump or our pump function from a cardiovascular perspective, our inline flow or our blood flow essentially getting into the lower extremity is reduced for reasons in part that you just mentioned, the inflammatory process that invades the different cell wall or wall layers of our arterial system become inflamed, which signals a cascade mechanism that leads to thrombus formation and clotting and decreased blood flow downstream. And as you already mentioned, that decrease in blood flow leads to a reduction in oxygen and nutrients getting to the location that is requiring more than just baseline to allow us to go on and heal. And I think it's a topic for another conversation if we were going to get into, the 4 specific processes in regards to wound healing itself. But specific to blood flow, it's the most crucial component. Without it, it doesn't matter how well we're controlling for the other variables. And so I think that it's very pertinent to mention at the outset that heart health is probably the greatest contributor to our success and or demise when we're talking about wound healing specifically and or diabetes in general.
100%. And I always say, people ask me all the time, you're a certified diabetes educator. What does that have to do with heart health? Everything's connected. We're talking about our blood vessels. Our blood vessels, if we don't have good flow to our kidneys, to our brain, to our lower extremities, there's going to be other complications. The second thing I want to talk about, which you mentioned, is okay, so a lot of times people are coming to you when they have a wound, when they have an issue. How do people detect? What's the early sign? How can we be proactive in prevention of these wounds from even forming?
So that's another great question. And then this is probably my favorite component behind this conversation, because in the wound healing world, we've made significant strides over the years, although I think we're still trailing and have another 5 to 10 years of having to do significant volumes of wound care and unfortunately amputation type of work in the operatory. But specific to the prevention programs and how do we slow the progression from a diabetes diagnosis to the presentation or onset of a wound is still a gray area with significant unmet need in the medical community. And so our group has been working on wound prevention strategies and the at-risk population for probably the last 5 or 6 years. And the one thing I could say is, from the point of diagnosis, it is imperative that you establish your team, your medical team that's going to help you from the very beginning get into a safe zone. Now, does some of that mean medical management? Potentially, but I think a vast majority of this is going to be lifestyle modification, a lot of changes to our daily activities, because it's crucial. And we can see some of the gaps, whether it's in the literature or the education, in the treatment room, whether there's a true understanding, whether the conversation is even being had. But at the level of the lower extremity, what we do know is that on presentation of a diabetes diagnosis, they should be immediately referred to a lower extremity specialist, whether that's a podiatrist, whether that's a vascular surgeon in your community. It doesn't matter who it is, as long as they have a complete and thorough understanding of the pathophysiology that we're trying to circumvent. And so I would say it starts with the establishment of good blood flow down to the level of the foot. Secondarily, they need a baseline neuropathy assessment. They can use a myriad of different tools to establish that there's baseline neuropathy. It's crucial that a patient understands and knows whether or not they have good blood flow, whether or not they have sensation to their feet. It sounds trivial to those of us that don't have diabetes and we can feel our feet and we know that there's a callus on the bottom of our foot that's bothering us and that we need to change our shoe gear or alter our walk or our stance. But if we have neuropathy, we don't know. We can walk around Disneyland and develop a blister and never have any idea until we end up in a hospital setting with a diabetic foot infection. And so it's imperative to set ourselves up for success from the very beginning. And I think that's the most crucial component from the medical community, is putting out the education and allowing the individual to understand at whatever level this is difficult stuff that you're about to embark on. And it's imperative that you start working on X, Y, and Z so that we never get to this place where we're having to make decisions in a hospital-based setting or a perioperative setting where we're potentially talking about limb loss.
Yeah, I think those are so many great points that you mentioned. First off, I have to comment on lifestyle is very important. And when I look at it from a lifestyle perspective, I think we also need to go into the before diabetic zone also. So I think we are testing for diabetes, but we're not testing for insulin resistance, which can happen decades before diabetes comes about. So if you're insulin resistance, if you know you have insulin resistance, and you can check this by fasting insulin levels, the HOMA IR, you can then make more proactive changes, and you can also be more aware of these potential complications. So awareness and mindfulness and seeking that additional support is definitely beneficial. Would you say, though, that like if you start getting calluses, if you start feeling sensation, that should be a sign that you should go to a vascular surgeon? Is there any at-home things to look out for as big signs of, okay, you know what, I think I need to consult with someone more quickly?
Sure. I think, a real cursory level type of examination at home for an individual with known or a diagnosis of diabetes, you're always looking for any type of color change in skin quality, a crack or a fissure of the heel, moisture in between the toes, a red swollen foot. Anything that's abnormal from your baseline is something that your provider is going to be concerned about. If it raises your level of awareness, you have to assume that it is on the radar of a physician and or provider, and that they're going to want to see it also. Never trivialize any symptom or visual cue or aid that you're experiencing and pass it off as something that's not of concern, because anything that captures your attention is going to be concerning to your providers for sure, just because they have a more trained eye specific to that niche. And so I think it's imperative that you get in early, you get in often. And these prevention programs that we're talking about now, The current payer system or insurance model or Medicare or whoever we're talking about, they haven't caught up yet to where we are when it comes to preventive strategies. It's a very reactionary model with individuals that are already afflicted, that are already struggling. And in order to get to where we truly need to be over the course of the next 5 or 10 years, we're going to have to start thinking outside the box, figuring out ways where we can bring individuals in month over month, doing surveillance on blood flow, doing surveillance on sensation checks, doing nail and callus care, doing skin care month over month, establishing home care regimens in regards to their bathing or hygienic routines so that we can make sure that we're optimizing moisture and hydration to the lower extremities so that anything that we can keep at bay, we're capable of doing. And at the same time, our patient population can do the easy things early and often and check those boxes that we were just talking about.
I love that. I think a lot of times there's this fear that, oh, well, if I go to my doctor, he's just going to amputate my limb. And I think it's important to go there early, like you mentioned, so that you can be proactive in preserving your limb. I mean, you can talk about how that's the last thing you want to do, right? It's more about, well, what can we do to help with the oxygen flow, help with the nutrient, allowing for good blood flow to that lower extremity versus amputating. So if you see any signs that there's a possible issue, speaking up and being proactive in your care is only going to help you. And that's really the big message that we want to put out today. So kind of taking a step back, we know that diabetes and heart disease are the top two chronic conditions globally. And I think it's important that we really emphasize the need for being preventative, even if you don't have known plaque in your arteries or known high blood pressure, high cholesterol, high blood sugars. You can always be proactive early to prevent wounds from occurring and also to optimize blood flow to all organs of your body. And so I think prevention is really important, but a lot of times we don't really react until there is a sign, a symptom, an increased lab parameter. And so we want to kind of stress the point of being aware, being mindful, and seeking that additional assistance as needed in order to, make sure that we're optimally making all of your organs, limbs, and part of your body healthy and happy. Do you have any, what, if you can leave us with one thing for everyone to kind of take into account for the prevention piece, please let us know. And then everyone stay tuned for our part 2, where we talk about how to address wound healing.
I think from a preventive standpoint, I think the one thing that I could say is that we all take our extremities, specifically our feet, for granted. None of us are looking at them, addressing them, doing anything with them until there's a problem. I think if we all just did daily inspection at a minimum, we would drastically reduce all of these horrific things that are occurring on a day-over-day basis. And so that would be the single greatest thing that I would say is crucial to just good adherence to a very easy protocol.
I love it. Thank you so much for coming on to my YouTube channel. I want to just give everyone Dr. Cazzell's information. Please feel free to follow him on Instagram at Shawn Cazzell DPM, or visit his website at valleydiabeticfootcenter.com, and stay tuned for part 2, where we'll talk about more wound healing strategies.
Thank you, Michelle.
Thank you.